When women get a pap smear result back, there are a whole variety of results that we can see, anywhere from normal to cancer. Cancer is quite rare. In between, there's abnormal cells that can be graded mild, moderate, and severe, and we often will do a secondary assessment by looking for the HPV or human papillomavirus that's the cause of the abnormal cells, and that also helps us determine what kind of follow-up is needed and how concerned to be. Colposcopy is a way of evaluating an abnormal pap smear. It is a procedure where we take a look, doing a speculum exam like we would for a pap smear, but I tell the patients all the time, instead of just looking with my eyes, I'm looking through a microscope so I can get an up-close and personal look at the cervix. So it's to evaluate what kinds of abnormal cells there are, how significant the abnormal cells are, and how extensive the disease might be. The process is, it's an appointment like a regular checkup, and it's in our same office space. We just have a special room for procedures. The procedure is very similar to a regular pap smear, but again, instead of just looking with my eyes, I look through a microscope to take a closer look at the cervix. There are a couple of different solutions that I can then apply that help me look for abnormal cells and get a sense of their grading. Are they mild, moderate, or severe? It is an evaluation procedure. It will often involve a biopsy or taking a little tiny sample of tissue, and I warn the patient before we do it, and it usually just feels like a small cramp. And that gets sent to the pathologist, who can then give us very detailed information about what's going on, and then based on that information, we plan the follow-up. With pap smear information, we have so much data, we've gotten much better at knowing who needs the follow-up testing and who doesn't. So we used to do a lot more of this, and now we can be a lot more specific and not have to put as many people through this kind of testing. This is something that often gives people a lot of anxiety, and they're very worried about it, and almost everybody after we finish says, that wasn't so terrible.